Hi, I'm Tom Lynch, Two Things. Today I'm delighted to be joined by Katherine Rushfirth and Marie Henderson. Katherine and Marie are both nurse midwives here at MGH. Marie, you're just tell me, what do nurse midwives do at Mass General?
So we take care of about 1,000 patients. We see women in 4 spots, 3 at the health centers here, and we promote a lot of the physiological labor, and we take care of women.
So we do about, if I remember correctly, about 3,800 deliveries
Yes.
at MGH. Katherine, what percentage of those are done by nurse midwives?
So I think right now in 2015 we did about 26% of the births. The midwives also provide about 90% of the prenatal care in our community health centers in Chelsea and Revere. So we're the primary providers out in those communities.
And Marie, what are the advantages of having a nurse midwife involved in the care of a woman who's pregnant?
So, we really promote the physiologicalness and the normalness of labor, try to focus on the prenatal education, immunization, all those health habits to put this woman in the best position to be a good mom.
And tell me a little bit about the impact you think it makes in prenatal care as opposed to the actual deliveries.
So in terms of prenatal care, there have been great studies looking at midwifery care for low-risk women, and the CDC estimates about 85% of women are low risk. And midwives generally have more time to do sort of a lot of patient education, really prepare people for labor. We talk a lot about breastfeeding, we talk about family planning because we can really provide comprehensive services. And actually when they sort of look back, they find that women who see midwives have higher rates of breastfeeding, higher rates of normal vaginal births, lower rates of epidurals as well.
Mm-hmm.
And Marie, what about home births? Do nurse midwives still do home births? Is that ever encouraged? Is that something MGH does?
No, we don't, but in the United States, the nurse midwife, that's really one thing that's really misunderstood about nurse midwives. 96% of our services are done in hospitals with integrated services. We are licensed to do births in birth centers, and it's a malpractice issue that there's very few home birth services in the United States, but it does exist. But nurse midwives predominantly practice in hospitals.
But if women do want the out-of-hospital birth option, there's 2 birth centers in Massachusetts, and both the American College of Nurse Midwives and the American College of Obstetricians and Gynecologists have supported birth centers.
And what would be one of the reasons a woman might choose an out-of-hospital birth center as opposed to a hospital birth center?
So birth centers, these are really, again, for low-risk women. Birth centers, a large study showed that there's a much higher vaginal delivery rate. Birth centers are really set up for natural childbirth, so you get full freedom of movement, you can eat and drink during labor, you can do water birth often. It's just sort of a different structure.
And Marie, it seems like it's important, one of the things we'd like to be able to do is offer women options, that what might work for Mrs. Johnson might not work for Mrs. Velez or for Ms. Parker, and that finding different ways of meeting different patients' needs probably sounds like it has advantages.
Exactly, and we're really proud that we've just implemented it in August of 2016 to offer women nitrous oxide. It's another option to help them reach their goal for birth. We're really proud of that.
Well, I want to thank both of you for what you're doing to improve our obstetrical services at MGH, particularly your outreach to the health centers. I'm Tom Lynch, and that's Two Things.